Good morning, everyone. This is Dr. Franklin Edward Shoemaker, and we're happy to have you join us this morning. We've got an exciting program for you, and on the Dr. Rad, the Attachment Code Breaker live innovation podcast this morning. And our guest is Sarah F. Corona, and Sarah has an MBA, MSL, and she's the Chief Executive Officer of Florida Behavioral Medicine. And it's certainly great to have you here today, Sarah. We've got a lot in common as a licensed mental health counselor, and with the clients that I see, uh, much of them with trauma histories and so forth. Um, we really depend upon each other in this field to treat the children and families out there. Tell us a little bit about what you do with Florida behavioral medicine.
Sure. Thank you so much for having me here. Okay, it's a pleasure to be part of this show. As you mentioned, I'm the CEO for Florida Behavioral Medicine. We are an outpatient clinic. We have 3 locations. We have one in San P, Largo, Tampa. I'm opening one in Brenton, and I'm looking to open one in Polk County because there's a huge need in Polk County. I am the Chief Executive Officer. I manage besides the clinics, I opened an IOP program, which is an outpatient substance abuse program for mental health and substance abuse. We also launched the Esprovato services. We have a TMS. We have a call center. My job is to negotiate contracts with the payers. Well, some part of my job. Also, I secure a state licensing. Um, I open a nonprofit because there's a huge need in our community, and a lot of patients they have lost their jobs and they don't have the luxury to come to the site to see the psychiatric and get their medication. So I just received the okay by the IRS, so I just working on the grants to also help the community in need. So one clinic is going to feed the other clinic, so the patients that cannot pay for their co-pays or have lost their insurance or they don't have the funding to get the service they need, we're going to be serving those patients.
Okay, that's great. That's great. Mental health, when we talk about mental health, Sarah, I mean, mental health just, I mean, you, it affects all the areas of our life, whether it's in the home, within the families, even, within our school systems and employment. And, it has such a bearing on our public policies and so forth. What do you, what do you see the biggest challenges from your perspective when it comes to mental health and serving the needs of the public?
Okay, let me give you a perspective. We serve child, adolescent, geriatric, and adults. I have seen huge increase. I mean, I've been working for these clinics for 5 years, and I have seen an increase from the child and adolescent. I mean, it's out of control. The lack of knowledge, the lack of resources, parents, they don't know what to do. Sometimes parents, they think that their kids are having behavior issues because that's what they hear from the schools, because, oh, maybe the kid got in trouble and the police officer is addressing to the parents, oh, there's behavior problems. No, there's always an issue with mental health. And we as a parents, if we cannot identify what's going on, how can we help our kids? How can we help the future of our children? Okay, it's going to be impossible because, like I always tell everybody, knowledge is power, and I'm not expecting for everybody to be on the same page that we are, which is we deal with mental health every day. But parents, we need to provide the tools and the resources that they need in order to help their kids. The same thing in the schools. I mean, teachers, they don't have the time. I'm going to be honest with you. They don't have the time. They have a classroom with 25, 30 kids, and they don't have the time to like do an assessment on each student to identify which one will benefit from counseling. Okay. So we as a community, I mean, I don't know, I'm running for school board. Okay. So as a school board candidate, I think it's important, okay, that we bring awareness to the community, okay, especially in mental health. Okay. I mean, we need to support our children, our students, not only mentally, but physically as well. It's a combination of different factors. Okay. But if they don't have the support, we're not going anywhere. And it's growing by day. I mean, I remember when I started working here, parents were like, "Oh my gosh, I've been looking for for a psychiatric for my child, for my adolescent, and the waiting time is like a month, 2 months. Like right now, we get so many calls per day, and the waiting time is 3 months, 5 months, 6 months. We can see children within 48. We can see anybody within 48 hours because I built a module which is works for everybody. And also not only like the mental health aspect, the financial aspect as well. Because I'm going to explain something to you. A lot of providers, they don't take kids because it's very complex. Okay. They don't feel like they have what it takes to provide a good diagnosis. Okay. And also, the insurance company are very, very demanding. Okay. So they feel like it's a liability. And that's what I get from a lot of parents. They call our clinics to schedule a new patient appointment with their children, for their children. So this is a global crisis, Ed, and it's not getting any better. And then
Yeah. Yeah, I see that, and I'm not exaggerating. I mean, from my perspective, and you can correct me if you feel like I'm, way out of line, but we've been in that epidemic for years now, and it's only getting worse, I hate to say. And um, as you know, my wife, she's a teacher um, in the Polk County schools, and she works with ESE students and so forth. And I used to be a educator, ESE educator at Mulberry High School, and it has, in the course of, and I left teaching it in 2010, but if you was to compare the students that I had back then to the students now, it seems as though the students are a lot more disruptive in the classroom and younger. You know, you never used to hear about, and I have clients come to me that are 3 years old, 4 years old that throw desk in daycares, and that's not even talk about the classroom disruption going on. But we're seeing a lot more younger kids that are just, I call it snapped, you know, in the classroom, and I have a pretty good knowledge of, what causes those behaviors and everything, um, but it's like, you're right, people are just lost when it comes to how to deal with them.
they don't have, this is my perspective. Let me put in perspective. Okay. Humanity is evolving at a faster pace that we cannot keep up with. Okay. The same way with mental health. Okay. So now, with technology, with the iPhone, with social media, okay, kids are getting, they're getting used to that. Okay. So when you take those equipments away from the kids, they react a lot of times. Okay. As a parents, we need to put our foot down and we need to spend quality of time with our children. And everybody's busy. And I know we live like in a very like busy society where everybody's trying to survive, economy, jobs, like parents with mental health, kids with issues. Okay. But I think as a family, a lot has to be with how is everything developed at home. Okay, everything starts from there. Let me give you an example. I translated for one of the Hispanic mom. Okay, she had 3 kids. One is an adult, like 17. The middle kid was like 10 years old, and the smaller kid was like 2 years old. What happened was she was paying more attention to the adult and the little, not the middle kid. The middle kid was acting up in school. So she brought the kid to our clinics. Oh, I think he has ADD. We need to test for ADHD. I had a conversation with the student, with the kid, okay? He was fine. He was like screaming out for attention. So a lot of times, because we as parents doesn't have the tools or doesn't we don't have the knowledge, we start medicating our kids that doesn't need to be medicated. So what happened is when the kids, their body is used to the medication, when you take the medication away, they start having withdrawals. They start acting up. So there's a lot they have to take in consideration when you are a parent, especially living in this like crazy world. Okay, you need to educate yourself. We're not expecting you to have a PhD, okay, but at least read. I don't judge whoever wants their kid to be medicated, but there's a fine line. We need to identify if that child actually needs to be medicated. Okay, I'm pretty sure when I was a kid, I have ADHD. I mean, I'm pretty sure because I'm, you know what, I'm Cuban. I'm very like hyper, okay, but I was functional, okay,
Mm.
and talking to one of the psychiatric, the medical director, he was like, Sarah, and he's one of the owners. We all have ADHD, but we are a different spectrum. Okay. I mean, we are like, but some people are functional. You see, I'm very calm, but I also have ADD. So, you know what? We don't judge, but we all have that. Now, because if I am diagnosed, I'm not going to be medicated. Why? I'm functional. Okay.
Mm.
That I can do 3, 4 things at the same time and then complete everything. Okay. But I'm not going to be medicated. So a lot of the parents, they see their kids are like acting up. Okay. And they think they have some certain like mental health issues, but they don't. Okay. We need to pay more attention to our children. And we cannot leave everything to the schools because you know what? The teacher's responsibility is to teach, okay? Not to educate our kids. Of course, we can educate. That is part of the support system. But we cannot put everything on the teachers, okay? It starts from home. And the teachers, that will be an extension, of course. I mean, everything is together. Family, teachers, caregivers, like providers, okay, everybody, we all contribute to the growth of that individual, but we cannot put that pressure on the teachers because they have a lot on their plate.
Oh, absolutely. They certainly do. And I know my wife and I, speaking of, parents, and God love our parents and so forth. And a lot of times I feel like they're doing the best they possibly can, but then again, it doesn't take long to figure out what's going on with our kids when you're out at a restaurant eating and you see a 3-year-old with an iPhone playing on the iPhone.
Exactly.
And,
Exactly.
and being an attachment, specialist that I am when it comes to attachment trauma and so forth, um, I see where once if you got diagnosed with reactive attachment disorder, you had to meet certain criteria in the DSM-5, abuse, neglect between ages of 0 and 5 and multiple placements and so forth. But see, seeing a new evolution of the kids that have attachment disorder that are ignored by their parents from 0 to 5, and
It-
they become attached to the social media, which later affects them down the road. And
exactly.
and that's where you're seeing, where I think that you're seeing a lot of the behaviors because, then suddenly you had that child has to socially interact with people,
Exactly.
and they don't know how to do it.
And this is the thing, Ed, they develop an addiction as an early age. Okay. So you have to understand kids have until they're like 18 years old to discover sexuality, who they are, and a lot of people like not until they're like 25. So like the brain is fully developed. Okay. So imagine a 3-year-old, you give them a tablet. Okay. What do you think is going to happen? Every time you take that tablet away, okay, they're going to be screaming, they're going to be yelling. And then as a parent, if you don't understand what's going on, that's when they're going to call you or call my clinics and like, you know what, I think my kid is autistic, or somebody's going to say, hey, I think your child is autistic or has some behavioral problem, but they don't understand. It's a domino effect. Okay. And we need to act right now because the food that we're eating is not helping. Social media is not helping. Technology is not helping. We're living in a very fast-paced society. Okay. So we are against different factors that is not really helping our children. So as a parent, as like you and me, we need to have like provide the community the tools and the resources they need. Okay, because I mean my kids are 25 and 27. I know it would be hard to have like a child right now with everything is going on. Okay, because I mean at least we have the tools and we understand the dynamic, but a lot of parents they don't. They're trying to survive. I mean, living in the morning, going to work, go home, deal with homework and everything. And a lot of times parents are so overwhelmed that it's easier to give their children a tablet. Okay.
Oh, yeah,
And
absolutely.
it's causing like irreversible damage because trust me, I seen it. I mean, we serve everybody, okay? And we have so many adolescents, we have so many adults, okay? They are going through what we just mentioned, okay? They have an obsession to social media. They cannot stay away from their phones, okay? It's affecting their family, it's affecting their job, their everyday life. I mean, we have in our IOP program, we have two programs, one daytime and one at nighttime. And the program is 3 days a week, Monday, Wednesday, and Friday from 9:30 to 12:30. It's a group setting. So we have 36 sessions and it will teach you how to cope with whatever is going on in your life. And it teach you and then give you the tools that you need, okay, to cope with whatever happened to you in the past or is happening right now or will happen in the future. And then also those individuals have the option to see the therapist one-on-one every week. Because a lot of patients, they don't feel comfortable talking or in a group setting. So they have the option to have one-on-one. We also develop the same program in the evening, Monday, Wednesday, and Friday from 5:30 to 8:30 for the individuals that work during the day. You'll be surprised how many people we have. And people think it used to be a stigma how mental health affect only like a certain demographic. We have millionaires in our clinics. We have doctors. We have therapists. We have architect, teachers, police officer, homeless. They're patients. So
Mm.
what mental health doesn't discriminate. It can affect anybody.
Oh, absolutely, absolutely, and, yeah, it has no barriers when it comes to socioeconomic status or, race, ethnicity,
Yes.
and, I even get a lot of, myself, older individuals in here, and when I say older, of course, I'm never gonna get older, but, talking about 60-plus-year-old men that come to me and say, "Dr. Shoemaker, I can't understand. I'm having these problems, these relationship problems with my wife, and I don't know what's going on." And it can be traced right back to, when they were younger,
Yeah. Yeah.
attachment trauma. So, no, you're absolutely right, and it's hard, you get caught up in those trauma loops because it's hard to work and whether you're a teacher, a therapist, a parent, a foster parent, adoptive parent, it's tough to deal with children that have, experienced childhood developmental trauma, when you yourself have unresolved trauma.
Exactly, exactly. And a lot of times, because I know some individual that their kids have autism, and they enable their kids because they're busy working, okay, and they'd rather do everything themselves, and they don't give those kids the tools that they need. And I'm like, okay, that's you not gonna live forever. What's gonna happen when you're not in this world? What's gonna happen to that child? And a lot of parents, again, is a lack of knowledge. Okay, is a lack of knowledge. They never deal with whatever happens to them in the past. Okay, so imagine you have issues, okay, and I'm going to give you another individual that you have to take care of, and then you have to watch that person to develop. How you going to help that individual when you never deal with the problems that you had in the past? So and a lot has to do with knowledge, okay, and it's really sad. It's really sad, but I mean, we got to do the best we can. We may not be able to save the world, but my philosophy: if we can change one person at a time, is enough for me. We have one of our therapists. He's a Marine. He was a Marine, and he has PTSD. So we have a lot of our patients, okay, with PTSD that sees him. But the difference is, even though he had trauma in the past, he has the tools and the resources that he needs to cope with that. And that's what we're trying to do in our clinics. Okay. We're not going to be able to, we're not going to be able to cure you, because this is not like cancer. Okay. Or I don't know, like high blood pressure that you take a medication and may go away. When you have a trauma, that's part of you for the rest of your life. What we do is we give you the tools that you need to cope with that. And that's what people needs to understand. Okay. Before, it was an stigma like, oh, you have mental health issues, you were labeled. Right now, we all have mental health issues. Okay. Some people are, I don't know, you're sentimental, you watch a movie and you start crying. Okay. That doesn't mean that you're crazy. Okay. But right there, you feel sad. Okay. So that necessarily doesn't mean that you had a trauma in your life, but that's the way I see. I'm very sentimental. I watch a movie, I cry. Somebody die, I cry. But that's me. I'm pretty sure you are the same, because we're humans. Okay, it's just trying to identify where's the line that we cannot cross. Okay, like if we get sad, we get depressed with whatever happens in the past. My dad passed away. When I think of him, I get sad. Okay, I get depressed. I don't have depression, but I get depressed. Okay, so we'll get anxiety, whatever is going to happen in the future. Okay, and that's what patients need to understand. That doesn't mean that you need to be labeled with depression and anxiety. No, it's a domino effect. Something that will happen or happens in the past that make you feel depressed, or something that will happen in the future that is giving you anxiety. But that doesn't mean that I'm going to be diagnosed with those two. And that's what patients need to understand. Okay?
Well, you're exactly right there, because I think the misconception is that if you have attachment trauma, it doesn't mean that something really traumatized you in the sense of trauma, like a hurricane came through or tornado that traumatized you. Attachment trauma is referring to someone that knows what attachment feels like, a relationship, and suddenly, because of that relationship ending, like due to death, like, you mentioned, mom or dad, every year, for instance, when my dad passed away, I remember him, I get that solemn feeling,
Mm.
but I don't necessarily have a diagnosis like you mentioned of depression, but to me, that's an attachment trauma.
Exactly. Exactly.
It's a memory, you see, that affects me. And see, and you hit the nail right on the head, Sarah, when you said that it doesn't necessarily mean I have a diagnosis or need to be medicated. I need that reassurance from somebody.
Exactly. But that's what happened, Ed. You come to a clinic, like in our clinics, we gave the patients what they need, not what they want. Okay, so here I have zero knowledge of mental health. I'm crying. I feel depressed. I have a job interview. I'm having anxiety. Okay, well, I think I'm depressed and I have anxiety issues. So I call a clinic. I need an appointment. And then you talk to a psychiatric or a nurse practitioner that is not well qualified, okay? And what do you think is going to happen? Oh, here we go. We're going to prescribe you lorazepam or a small dose, or higher dose, whatever they decide. What do you think is going to happen to that patient? That patient is going to be attached to that medication. It's going to end up being addicted because those are very addictive medications, okay? They're benzos, and what's going to happen is if you don't have the medication, you're going to have withdrawals. You're going to start acting up, okay? So right now, because you were depressed, not depressed, but you were sad because something that happens in the past, or you have anxiety because upcoming interview, now you are part of the mental health world because you have been medicated.
Mm-hmm.
Just you didn't have to. So this is the way I see it. Everybody in life, they need to understand what is their why in this life. What is your purpose in this life? Okay. What are you doing what you're doing? Okay. What is the purpose behind? I think it's a way to motivate the community. Okay. Because a lot of people, if you're like busy working in different projects, you don't have time to get depressed. Trust me, you don't. I have extra water. Okay. We have patients like our IOP patients, when they are involved, we get them to do different activities. Okay. Here, they don't think about anything. They don't get depressed or anything. Now, the day that they go home and they don't have the IOP, they come the next day crying, all depressed. Sarah, you know what? Without the IOP, I don't have anything else going on. Okay, so all I'm doing at home is thinking, okay, and it's killing me. So we need to, as a community, we need to create programs, okay, for individuals, for everybody, where they can spend time and do something different. It could be like community work, okay, going to shelters, but they need to know that they can be helped, they can be useful. I have three, in this area is different in Polk County. Of course, I've been there for like almost 40 years, okay? But in Pinellas, Hillsborough, Seminole is a different area for me. So I have to start from scratch, making phone calls, kind of get to know like the community. So I connected few of our patients from IOP to different organizations, okay, that they need help. Let me tell you, Ed, from the perspective of the group therapy, individual therapy, and then getting busier and help the community, totally different. Their medication, they're like, there's a lot of medication they're not in, that has been discontinued, okay, because they're busy, okay? They don't have time to sit home and feel sorry for themselves. So this is a combination of the different factors, okay? And we all have to work together.
Right. Absolutely. Now, you mentioned that you're running for the school board here in Polk County, Sarah. What do you tell a teacher um, that's got the disruptive classroom, that has acting out, that feels like they're not, not getting the support or whatever? What do you do?
Okay, I'm going to tell you from the perspective of being a mom, okay? The first thing we need to do is we need to identify if that child that is acting up, okay, what's going on with that child, okay? Because it may be a sign of something deeper that is going on that we as a teacher or the school, we're not aware of that, okay? So we need to set up a meeting with the parent, and we need to be careful because you know what? A lot of parents may be offended if we mention mental health, okay? So we need to address like, this child, your son or your daughter is acting up in class, and I want to know, has been any changes at home, okay? Because a lot of children, when there's like where there are changes, if the child was normal meaning normal behavior, and they start acting up, there's something going on, okay? And right now, I don't trust anybody when it comes to like child abuse. It could be physical, sexually, emotionally. I mean, we have to be careful. Everybody, we need to be on the lookout. Okay, I have to be careful, but we need to be on the lookout. Okay, so first of all, we need to identify what's going on with that child. If this is a regular class, that child needs to be placed in a different setting. Okay, because maybe that child mentally cannot keep up with the what's going on in the classroom. So imagine if he feels like he's left behind, that child is going to be acting up. Okay, so as I think as a school board member, okay, I mean candidate, we need to create programs where we can help not only the students but the teachers as well. Okay,
Absolutely, yeah.
putting a lot of pressures on these teachers. Okay, it's a lot of politics going on. There's a lot of bureaucracy. I mean, they have to teach, keep up with the behavior. A lot of the students, they don't need to be in a regular classroom. They need a different setting. And I'm not talking about with those kids are normal, because I don't believe in labeling a child. Okay, if they have behavioral issues, okay, don't put them like in a special need class. We need to identify and we need to create programs where that child receives the attention and the resources and the tools they need to cope with their behavior. Okay. So we need to we need to dig deeper, okay, and find out, first of all, why it's happening. Okay.
My wife and I were at a restaurant. It must have been 5 years ago now, and a young man, looked like he was a teenager now, walked up to my wife, while we were eating, and, told her, says, "You're Mrs. Shoemaker, I had you, in school at Medela, and, you're the best teacher I ever had, the best teacher I ever had," and gave her a hug, and, I asked my wife after the young man left, I said, "Who was that?" She kinda chuckled a little bit and said that he wasn't even a student of hers, that, he only came to her class when he had detention.
See?
But see, those are the kind of stories we need,
Yep.
instead, I mean, because that tells me, whether it's my wife or another teacher, that tells me that that student got the attention that he needed, whether it was just sitting in her classroom and being there for detention or not, he felt reassured.
And this is, I'm glad that you mentioned that. I worked years and years and years ago, middle school. I was a para educator. I did it because I wanted to spend time with my children. Okay. And I did it for a short amount of time. And I was working in an ESC class. Okay. In that class, I was helping a teacher. In that class, okay, in that classroom, there were kids that were autistic, okay, that have autism. There were kids with behavior problems, okay, and there were other kids that have some mental retardation. So the kids that have behavioral problems, okay, I was able to have the one-on-one and spend quality of time with them. Let me tell you something. Those kids graduated from college, okay?
Mhm.
We had like a diversity. There were like two African Americans, one Hispanic, and one was from Asia, and the other one was American. Um, they It's very important when you are growing up, the setting, your household, what's going on. Okay, dad was incarcerated. Okay, mom was out of the picture. Was raised by a grandmother, and the grandmother was older. Okay, so you need to pay attention to those kids, because again, we cannot label those kids. How do you think they're going to behave? Okay. They're going to feel like, okay, I was dumped by my own family. Now I am dumped by society. I'm in this classroom with all these kids, okay? Because they don't want to deal with me. I mean, if you take the time to talk to those kids and find and dig and see what's going on, I promise you the outcome is going to be different. I'm not going to tell you for everybody, but I'm pretty sure we can save a handful of kids, okay?
Well, and it goes to remind me, When I was 17 years old, Sarah, and like I mentioned before, I grew up in a very tight family. And my mom, had, polio when she was young. My dad had a heart attack when he was 40, when I was 13 years old. And I was terrified he was going to pass away. And my mom and I would have to move in with, my grandmother or my aunt and uncle and so forth. But, that weighed on my mind, and I came from a very good, normal family, about as normal as you can get, I think. But when I was 17 years old, I didn't do well in school. And it was January of 1978. My American government teacher came up to me before class started and he said, "Hey, Shoemaker," he was also the coach of the football team. And Coach Fred Zeckman was his name. He said, "Hey, Shoemaker, stay here after class. I need to talk to you." And boy, I was scared to death. I was scared to death. So I waited and he sat down with me, pulled up a chair, straddled it, sat down. And he said, "Hey," he says, "man, you got a lot of potential. I know your mom and dad, they're great people, what's going on? If you don't get straight A's in American government the rest of the school year and bring up your GPA, you're not going to be able to walk with your class." I mean, he says, you got to turn it around, and that man became the most influential man just for that 5 minutes in my life because I turned it around, got straight A's the rest of the school year,
Good.
got on the honor roll for the very first time, and I graduated, Sarah, with a whopping 2.11 GPA, just enough to graduate. My class rank was 248 out of 263.
Wow.
Terrible. 18 or whatever from the bottom. But I say this because I just wish that all the teachers, everybody associated with education and school, would take that and use it. One person for 5 minutes. And when I met my wife, she was the other very influential person in my life when I met her at age 27 and had a very positive influence on my life. Got my doctorate degree. Took me a year longer than I was allowed, but I got it.
Good.
3.66 GPA. But I say all this to send a message that, sometimes kids are worth more than just a number or a statistic.
Yes. Yes. And I want to bring something to your attention. I want to share something with you. I came from Cuba in 1990. Okay. We were a political refugee. Okay. Cuba is a communist country. It's a dictatorship. So I came and I already graduated from high school in Cuba. So I brought my grades, straight A student, 4.0 GPA. Well, I started Lakeland High School because I was told repeat the 12th grade. That way you will graduate from high school in the United States.
Right.
Anyway, when I failed the first test, oh my gosh, I have to call my mom. I break down because a straight A student. I didn't get depressed. Okay. I didn't get depressed at all, but I was determined, okay, to graduate again. I graduated when I was 16 from Lakeland High School. I remember Paul Community College, okay? I used to write my social security in my hand because I didn't speak English. It was hard. In math, I have an A because it was number. I'm really good when it comes to like budgeting, numbers. I'm great. But the English aspect, it was horrible because I didn't speak the language. But you know what's the difference? I didn't allow that to stop me. Okay. And my parents, my mom, she had a PhD. She was like, Sarita, because my nickname is Sarita, we immigrated to this country to provide better future for yourself. I mean, are you going to sit down and allow the English barrier to like pull you down? And I realized, you know what? I'm going to move on and I'm going to do whatever it takes. I didn't pay attention to all the negativity. I didn't pay attention like that I didn't know how to speak English. That probably people will make fun of me. I didn't pay attention. I never felt bullied in my life. And I'm pretty sure there was bullying around. Never felt it because the way my mind was set up. Okay. And the way the perspective that I was bringing to everything. And I think is so important. Okay. In this case was my mother, but a lot of these children, they need validation. They don't have anybody they can tell them you can do this. Not because the parents doesn't want to do that. A lot of parents, they don't understand how important that is. Okay, because we're shaping them for the future. But that's when the teachers, that 5 minutes can make a difference in anyone's life. And it's anywhere, here too. Okay. When we have some patients, they're like a little destructive and they're not happy with the provider. I get to talk to them and I turn things around because you need to be motivated. You need to focus on the solution, not the problem. And that's what's happening nowadays. Okay.
Mm.
Life is not perfect. In my clinics, the turnover is like 1%. I have employees since I started because we grow. I mean, I have to hire new employees, but we don't have gossiping. We don't have drama. You got employees that have their own issues going on, but I think it has to do with leadership, how you lead your team. And that has to do for everything. A school board, I mean, doesn't matter what position you're in, it has to do with everything. How you lead your team, how you motivate your team. Okay, because if you focus on the problem, Ed, trust me, you're going to end it up in one of my clinics or an appointment with you. Okay, because you're going to be depressed, you're going to have anxiety because you don't see the light at the end of the tunnel. Okay, just forget about the problems, focus on the solution, how we're going to get there. Okay, how I can help this. Okay, look outside the box, and I promise you, you're going to make a difference. But
Well, and when you have it in your heart, people can tell when you have something really in your heart.
yeah,
And, you know, um, you have to be approachable. That's the big thing, to solve problems approachable because, what I've learned in throughout life in the last 33 years, Sarah, is, if you're not approachable, I mean, people can see through the fraud and and see your real intentions or a real motive, I should say. And um, my wife and I, when we first started working with kids, at Father Flanagan's Boys Town, never had really any problems with the kids whatsoever. And we had one of our a worker that we worked with there that referred to us that kids can see through that. They know when somebody's on their side. They really know they can see the heart before anybody else can.
and they
And
see people, they can see people's true color. And this is the thing, and I don't mean to call you off. You need to have empathy. Whatever you do in life, you need to
yeah,
have empathy. You cannot judge people. I don't judge. Okay, I mean, I treat everybody the same way. Okay, with the same respect and the empathy, because being in the medical field, especially mental health. Okay, this is what I tell my providers when I do the onboarding, when I'm hiring. Okay, don't do this because of the money, because it's not worth it. There's no money in the world that will pay you to deal with mental health. Okay. Just do it out of the kindness of your heart. I mean, if you have what it takes, if you have the passion, go for it. If you don't, this is not the right place for you.
right, exactly,
Because
exactly.
and it's the same. My mother was a teacher. Okay. She was a teacher for 35 years. Okay. And she was a teacher in areas that the kids were like, because in Cuba we have like gangs, not like here, but they were like gangs. Kids were like stabbing other kids. And my mother was able to turn those kids around because, like you mentioned, the approach. Okay. A lot of those kids didn't have that support from home. Okay. They came from broken homes. But as a teacher, I mean, it's our responsibility. We not only teachers, administrators, like paraeducators, like the custodian, everybody. Okay, you never know like how that kid is going to react. Kindness, like bring kindness. Okay, if you are negative, if you're mean, what do you think is going to happen? When
Yeah.
we have that patience, okay, this is what I tell my team. Don't take it personal. We don't know what that person is going through. Okay. Never lose your professionalism. Okay. Stay, stay level. Okay. And we have patients that when they're upset because they don't have their medication, they go to like a million, and then we keep the same tone. And trust me, they come down and they apologize. Okay. So it's how you approach the world, the community. I think if everybody will have empathy and then will have a different approach, this would be a totally different world, and the outcome would be totally different. That's my personal humble opinion. Okay.
Yeah. Well, and before we wrap up, I'm the chair of the SAC committee at Medell Elementary. And I know over the course of several years, maybe 5 years or so, we've seen a big change in the demographics. And with the population that shifted to a predominantly Hispanic school.
Yes.
And I think, if I'm not mistaken, that even Polk County is at like a 45%.
It's almost 40, it's almost 44%. And I was invited some of the schools they are in my district. There's 23 schools. And for example, Mulberry High School, Mulberry Elementary, I mean Mulberry Middle School, 65% of the students are Hispanic.
Mhm.
And then you gotta realize, like, from the perspective of in Hispanic, like in your countries, you mentioned mental health, and they think about like schizophrenic or like so
Yeah.
the lack of knowledge is alarming. Okay, so how
Mm.
would help those kids like approaching the family, providing the tools that they need, okay, and teaching them, okay, and you'll be surprised. But yeah, it's true. Polk County has almost 44% of the students are Hispanic.
Now, what area do you cover, Sarah, with your Florida behavioral?
We cover the entire state of Florida, and we have patients that have moved out of state. However, even though our clinics are in Largo, Tampa, and St. Pete, we have patients all over Florida. Now, I'm working also on a compact license. I don't know if you're aware, there's 30 something licenses from different states that you can buy. And the state of Florida was approved in December 2024, meaning you don't need, whoever participate in the compact license, you don't need to physically have an office in those states.
Mm,
So
okay.
I did my diligence, I did my research. So I'm going to start applying for rural areas where you have 20 plus thousand patients per one provider. That way we can provide services to those areas. But we can see patients all over Florida. We have
Oh,
we have a huge community from Polk County. We have Orlando, we have Miami, Tallahassee, Jacksonville, Ocala. I mean, everywhere. Because right now with we have the luxury to provide telehealth and
yeah.
so and we serve those everywhere in Florida and outside Florida as well.
Now, if somebody wanted to get a hold of you and talk to you about Florida behavioral medicine, correct?
Yes.
Um, how would they get a hold of you?
If they want to get a hold of me, they can call me on my cell phone,
Okay.
which is 863-812-6127. And if they need an appointment, I mean, we like if it's like how sometimes refer people like patients to us. Okay. I mean, we have a department that handles that, but I get a lot of personal referral. It's funny because when they call me, they go like, Dr. Corona. I'm like, no, I'm not a doctor, but we help everybody. And we get in a lot of adolescent and child from Polk County. Is insane. Okay. But they can call me and I will connect them with the new patient department and we can get them in within 48 hours. They don't have to wait like any mental health clinic or actually any specialty in healthcare. You have to wait minimum 6 weeks as a new patient.
Right.
Mental health, minimum 3 months. Okay. Right here in our clinics, I can get you an appointment as a new patient within 48 hours.
Well, and I can professionally attest to that because, I mean, you've helped, us out in mines before, and my clients have been absolutely thrilled to death they were able to get in and set an appointment up within 48 hours. Now, if somebody also wanted to reach out to you and just talk to you more about the school board race,
Yes.
what would they need to do?
They can call my cell phone and I'll be more than happy to connect with them.
Okay, and do you have a website?
I do have a website. I do have a website. It's sarah.corona at schoolboard.com. I think it's something, something like that. But if they type Sarah Corona, like my website is gonna come up because I am an official candidate for District 3. And this campaign is countywide. So
Right, right.
it's from one end to the other one. But anybody can reach out to me. And you know what? I'm also I'm Catholic. Okay, my husband and I we have done some missionary work, and that's what I want to do in the future. I want to like travel the world and then go to places where they don't have anything. Okay, and help them out. So we have been doing that. We have traveled to different countries to help. But I also have people that call me and say, "Hey, Sarah, I have, you know what? I have so much clothes that I don't need it." Okay, and then I'll take it out of their hands, and then we help people that are in need. Not only in other countries, like in the community as well. Like in Largo, I have never seen such a huge homeless community. It's insane because they don't have shelters here. Okay, they have like nonprofit, but not shelters. So anybody can call me for mental health, for the school board campaign, or for to help homeless community. I'm here for.
Okay, okay, that sounds great, and, well, it's been absolutely wonderful to have you on today, and I know that you're probably gonna get a lot of calls,
Thank
uh,
you so much. Appreciate it.
and this broadcast will be, it it'll be saved on our Substack and also distributed where, all of our subscribers will have access to it. But I really appreciate it, and, just keep up the great work and with the behavioral health because we certainly need it. I would say we have a shortage right now,
We
when
don't.
it comes to mental health counselors and so forth. And we just gotta keep our educators, in our prayers, the educators, because, they try their best. They're just like the adoptive parents that I work with, they do their best. They get compassion fatigue a lot of times and feel like it's never gonna get any better until they get that pat on the back, sitting in a restaurant, so
Okay, can you hear me?
Yeah, I
How,
can hear you now.
okay, how can we provide high quality of education if our teachers and the staff doesn't feel supported? It's not going to happen. It doesn't matter. It's not going to happen. Okay, they need to know that we're here and that we're fighting for them. Okay, and that's what I intend to do. This is not about talking. This is about delivering results, and I'm really good at that. Okay,
No,
so thank you so much for inviting me. I really appreciate it.
Okay, well, you have a great day,
Thank
and
you.
we'll talk to you later, and maybe we can chat again down the road.
Sure. Sounds good. Thank you so much. And thank you for everyone that have connected to this live. Okay. Take
Okay,
care. God
thank you
bless.
very much.
Okay. Bye bye.
And this has been Dr. Ed Shoemaker, and thank you for tuning in today or tonight, whenever you decide to watch this live interview. Thank you and have a blessed day.
Good night. Bye.